Hello everyone, I'm Monica and I am going to conclude on our stance against cosmetic surgery. As Audra stated in the beginning, the introduction of our speech, we are against cosmetic surgery, but we also want you guys to understand that there's a difference between cosmetic surgery and what we would be okay with explaining with reconstructive surgery. Cosmetic surgery is more so of a surgery that doctors would call an elective surgery, meaning it's something to enhance or to help the patient feel within, I guess, maybe themselves that it's something that they would like. It's not necessarily something that they need or something medically or something that can actually save their lives. Whereas reconstructive surgery falls in line with cosmetic surgery, but it's also, doctors will call that a medical procedure that is needed. A lot of examples to help you all further understand cosmetic surgery being larger breast, breast enhancement, boob job as we would call it, or I want my nose to be fixed, I want bigger lips, or Botox, or just wrinkles to be gone, or we stated also having a bigger butt or anything like that that just to help the person's self-esteem or just help the person within feel better is something that will fall under line with cosmetic surgery. With reconstructive surgery, we would most likely, like I said, doctors explain that to be something that is medically needed, but it does still fall under cosmetic surgery. We are against cosmetic surgery, but as a whole, we're saying that we're not against someone who has had breast cancer, who's battled breast cancer, and now, sadly, they were able to survive, which is great, but they basically have deformed breast, or they have pretty much sunken in, which anyone who knows what breast cancer, once you go through that, a lot of times the breast gets really deformed and a lot of tissues are destroyed, so the breast pretty much looks like it has sunken into the chest. Now, a cosmetic surgery to help the patient or to fix that, that is something that will go under reconstructive surgery, which is kind of medically, not saying that if you do go through breast cancer, you have to get your breast fixed, but it's something that falls under it, under reconstructive surgery, that my group and I would agree to be okay with. Another would be someone who has been in a pretty close to fatal car accident, and a limb was detached and they're going to get it attached again. That again is a cosmetic procedure, but it falls under reconstructive surgery, which is to help the person reconstruct anything that is to help the person move forward in life, or to help them to be able to get through life a little bit easier, is something that we do not stand against. Another situation as well, a cleft lip. That is something that is most common found in a lot of Asian communities, and that's pretty much where the lip and the whole mouth is pretty much, the jaw area is deformed, and it makes it hard for children to speak. It makes it hard for them to eat, swallow, pretty much do anything when it comes with the mouth area, and that is something that will hinder them further on in life. So actually reconstructing the lip, we would say that's something that is definitely able to be done and that we wouldn't stand against. We just want you all to know that we are not saying that cosmetic surgery is the devil, it's himself, but we're just letting you all know that there are a lot of downsides, just like to anything else, of getting cosmetic surgery, and especially with something that is not 100% needed, or something that could cause you more pain, or financial crisis, or anything, even death, to the fact that you really don't need it. Reconstructive surgery is something that will help you in the long run. It's something that would pretty much give you life again if you were in a freak accident, or anything was done, or anything was amputated, or anything of that nature. We are acceptable and understanding of those situations, but just to, fit in with what we call cool, or the it look, we're not really 100% for that. So it's just something to think about if anyone was thinking about getting it. For myself, when I think about it, just a personal relation, there's a lot of people who think my lips, which they are pretty big, but it's genetics, I can't help it. If you actually think about people who are actually really willing to go under the knife or go under anything just to get bigger lips, I really don't see the cost of it, because I mean, they're just lips. I'm not sure what it feels like to have small lips, but I do know what it feels like to have big lips, and as long as you have them, I think life is fine. Also, another thing that I've known for a lot of people to do that's cosmetic related, they call it a beauty mark, which I have one. It's right here. People actually go and get those tattooed on or get them permanently put on, and again, still, just think about it. It's really not that serious. So I think my group and I can all agree that if it's not broken, don't try to fix it. Thank you.